It's a pleasure to be with you. The title of this session is Environmental Public Health Practice, Part 11, Food Safety. There are no disclosures for this presentation. Objectives include discuss the impact of foodborne illnesses globally and in the United States, review major pathogens that cause illness, hospitalizations, and deaths in the United States. Review marine and mushroom food toxins. Briefly discuss organizations and agencies that regulate food safety. Review the 5 common factors that impact food safety. A foodborne illness is an illness caused by consuming contaminated food or drink. A foodborne illness outbreak is when 2 or more people get the same illness from the same contaminated food or drink. From 2009 to 2018, Public Health evaluated 8,131 foodborne illness outbreaks in the United States, or an average of 2.5 outbreaks per day. Many of these outbreaks involved multiple states. This graph shows how electronic disease reporting, initiated in 1998, increased the identification of foodborne illness outbreaks in the United States, represented by the tan bars on this graph. The World Health Organization states that each year an estimated 600 million people fall ill and 420,000 people die from unsafe food, resulting in the loss of 33 million healthy life years daily. Children under 5 years of age are at particularly high risk, with 125,000 children dying from foodborne diseases every year. These illnesses and deaths are largely preventable. This CDC table provides the annual estimate of foodborne illnesses, hospitalizations, and deaths due to 31 pathogens. Annually, 47.8 million people, or 14% of the United States population, have a foodborne illness, resulting in 127,839 hospitalizations and 3,037 deaths. This CDC graph shows a breakdown of foodborne illness outbreak food sources from 2009 to 2016. Fish were the most common source of foodborne illness at 17%, followed by chicken and turkey as poultry added together at 13%, dairy 11%, beef and mollusks each at 8%, pork 7%, vegetables from row crops and fruits each at 6%, with the rest at less than 5%. Other sources were at 6%. This table lists major food contaminant categories and examples of each. The categories include biological agents, for example, bacteria, parasites, protozoa, fungi, viruses, prions, and microbial toxins. Chemicals, for example, marine and mushroom toxins. Heavy metals, pesticides, herbicides, fungicides, preservatives, and additives like excessive nutritional supplements. Animal medications, for example, antibiotics and growth hormones. Physical contaminants, for example, bones, shells, seeds, glass, metal fragments, and stones. Packaging materials, for example, plastic residues and waxes. And miscellaneous, for example, insect parts, rodents, fecal material, fur, and cleaning agents used in food processing. The most common food contaminants are biological, chemical, and physical. In this session, we will focus on biologic and chemical food contaminants. This table is adapted from the 2024 CDC Food Safety Report and lists the 5 most common organisms causing foodborne illness, hospitalizations, and deaths. For illness, norovirus is most common, followed by non-typhoidal Salmonella, Clostridium perfringens, Campylobacter, and Staphylococcus aureus. For hospitalizations, non-typhoidal Salmonella is most common, followed by Norovirus, Campylobacter, Toxoplasmosis, and E. coli 0157. For deaths, non-typhoidal Salmonella is most common, followed by Toxoplasmosis, Listeria monocytogenes, Norovirus, and Campylobacter. An important responsibility of federal, state, and local governments, including their public health agencies and departments, is to ensure safe foodstuffs by regularly inspecting food supplies, investigating foodborne illness outbreaks, and carrying out surveillance activities. Foodborne illnesses are surveyed through passive and active processes. Passive surveillance occurs when clinical laboratories and clinicians report foodborne illnesses to their local and state health departments. The CDC's Foodborne Diseases Active Surveillance Network, also called FoodNet, is an active surveillance system that regularly conducts laboratory, clinician, and general population surveys regarding foodborne illnesses since 1996. This map shows the U.S. FoodNet surveillance system, represented by the dark green areas covering 16% of the U.S. population. The FoodNet program is part of the larger CDC's Emerging Infections program. In this session, we will cover common foodborne pathogens in the biologic categories of bacteria, viruses, parasites, and prions. Let's start by briefly discussing bacterial causes of foodborne illness, including Salmonella, Clostridium, Staphylococcus aureus, Escherichia coli 0157H7, Campylobacter jejuni, and Listeria monocytogenes. Bacteria are classified by their gram stain, or ability to stain blue when exposed to gentian violet together with Gram's solution. Those that stain blue are called gram-positive organisms. Those that don't stain blue are called gram-negative. Bacteria may also be classified by serotype, which means that a bacterial isolate reacts with antibodies produced against that bacterial group or isolate. Bacteria can cause foodborne illness by 2 routes: foodborne infection and foodborne intoxication. Foodborne infection is defined when symptoms are caused directly by a bacteria, where foodborne intoxication is caused by toxins produced by a bacteria. Salmonella causes an illness called salmonellosis. Salmonella bacteria are gram-negative organisms that are among the top 5 causes of foodborne illness, hospitalizations, and deaths in the United States. The CDC estimates that Salmonella causes about 1.35 million illnesses, 26,500 hospitalizations, and 420 deaths in the United States every year. There are more than 2,500 Salmonella serotypes. Of the 47 Salmonella serotypes reported to the CDC that were associated with outbreaks from 1998 to 2008, 4 serotypes were the cause of 66% of those outbreaks. Salmonella enteritidis, 36%, Typhimurium, 14%, Newport, 10%, and Heidelberg, 6%. Salmonella typhi is another serotype that causes a disease called typhoid fever. The CDC estimates that 9.2 million cases of typhoid fever occur worldwide each year. In the United States, typhoid fever infects 5,700 individuals, resulting in 620 hospitalizations annually. Most people in the U.S. identified as having typhoid fever were infected while traveling internationally. Acute symptoms of non-typhoid salmonellosis occur after an incubation period of 6 to 48 hours and include nausea, vomiting, abdominal cramps, diarrhea, fever, and headache. Acute symptoms may last 4 to 7 days or may be prolonged in some individuals. Some individuals with salmonella infection develop joint or reactive arthritis after the infection has subsided. Reactive arthritis is difficult to treat and is likely due to an autoimmune response caused by the infection. Reactive arthritis can last for months or even years. Some people with reactive arthritis also develop inflammation or irritation of the eyes and dysuria or pain with urination. Diagnosis is by stool culture and serotyping of isolated organisms. Most people recover from salmonella infection within 4 to 7 days without antibiotics. Antibiotic treatment is recommended for people with severe illness, those with weakened immune systems, for example, HIV infection, or those on chemotherapy. Individuals over 50 years old with underlying conditions, for example, heart disease. Children under 12 months old, and adults 65 years old and older. Antimicrobial therapy may increase the risk of developing a chronic salmonella carrier state. As mentioned previously, typhoid fever is caused by Salmonella serogroup typhi. Typhoid fever presents with a sustained fever, 103 to 104 degrees Fahrenheit, weakness, stomach pain, headache, constipation or diarrhea, cough, and loss of appetite. Some people with typhoid fever develop a rash described as flat, rose-colored spots. Complications of untreated typhoid fever can include intestinal perforation, septicemia, dehydration, and death. Without treatment, the case fatality rate for typhoid fever may be as high as 20%. Treatment of typhoid fever with antibiotics is important to prevent severe disease and death. With treatment, the mortality rate ranges from 1 to 4%. There are effective inactivated injectable and live attenuated oral vaccines available to protect against typhoid fever for individuals at risk of infection. These typhoid vaccines have a vaccine efficacy to prevent disease of 40 to 90%. People can get salmonella infection from a variety of sources. By eating contaminated food, drinking contaminated water, and touching infected animals, their feces, or objects in their environment. Foods associated with salmonella outbreaks include raw meats, poultry, eggs, including eggshells, unpasteurized and improperly pasteurized milk and dairy products, imported fruits and vegetables, breakfast cereal, fish, shrimp, frog legs, yeast, coconut, sauces, salad dressing, cake mixes, cream-filled desserts and toppings, gelatin, peanut butter, cocoa, and chocolate. Imported fruits and vegetables may be contaminated by sewage used for irrigation and poor hygienic behavior of workers. Salmonella antimicrobial resistance limits treatment options for people with severe infections. When a bacteria is exposed to an antibiotic over time, it can develop antimicrobial resistance through a variety of mechanisms. A major way to reduce antimicrobial resistance is by appropriate use of antibiotics for humans and animals. Let's now consider the Clostridium class of bacteria. We will briefly discuss Clostridium perfringens and botulinum during this session. Clostridia are gram-positive obligate anaerobes, meaning they thrive in environments lacking oxygen. Clostridium perfringens is among the top 5 organisms that cause foodborne illness in the United States. The CDC estimates that Clostridium perfringens causes 1 million cases of foodborne illness in the United States every year. Clostridium perfringens is a common colonizer of the intestines of humans and animals. But after the consumption of large numbers of those bacteria, symptoms can be experienced, including abdominal cramps and diarrhea. Clostridium perfringens forms resistant spores that contributes to its survival in soil, wastewater, feces, and foods. The incubation period for Clostridium perfringens illness is 8 to 22 hours after exposure, and the illness is caused by a toxin produced by the organism. Symptoms usually last 24 hours, though some milder symptoms can last for 1 to 2 weeks. Improper cooking of food and dangerous holding temperatures of food after cooking are often implicated in outbreaks. Bacteria grow most rapidly in the range of temperatures between 40 and 140 degrees Fahrenheit, doubling in number in as little as 20 minutes. This range of temperatures is often called the danger zone. The most common foods associated with Clostridium perfringens outbreaks are meats and meat products, for example, turkey, chicken, beef, pork, and gravy. This slide lists some key recommendations to keep food out of the danger zone. Never leave food out of refrigeration for over 2 hours. If the temperature is above 90 degrees Fahrenheit, food should not be left out more than 1 hour. Keep hot food at or above 140 degrees Fahrenheit after cooking by placing cooked food in chafing dishes, preheated steam tables, warming trays, and/or slow cookers. Keep cold food at or below 40 degrees Fahrenheit by placing food in containers on ice. Raw meat and poultry should always be cooked to a safe minimum internal temperature as shown on this graphic. When roasting meat and poultry, use an oven temperature no lower than 325 degrees Fahrenheit. Reheat food to an internal temperature of 165 degrees Fahrenheit or until hot and steaming. In a microwave oven, cover and rotate the food so it heats evenly. One of the most common causes of foodborne illness is improper cooling of cooked foods. Bacteria can be reintroduced to food after it is safely cooked. For this reason, leftovers must be put in shallow containers for quick cooling and refrigerated at 40 degrees Fahrenheit or below within 2 hours of cooking. Clostridium botulinum, like perfringens, produces spores. It also produces a potent neurotoxin. Clostridium botulinum spores are somewhat resistant to heat, but can be eradicated by heating to 176 degrees Fahrenheit for 10 minutes or longer. Ingesting a few nanograms of botulism neurotoxin can cause botulism symptoms. The incubation period is generally 18 to 36 hours, with a range of 4 hours to 8 days after ingestion. Botulism symptoms include extreme fatigue, weakness, vertigo, double vision, abdominal distension, constipation, and difficulty breathing, speaking, and swallowing. The case fatality rate can be as high as 5 to 10%, especially in those that don't receive immediate medical intervention. For example, the early administration of antitoxin and intensive respiratory support. Foods that support Clostridium botulinum growth and toxin production are generally those with a pH above 4.6 and include many canned foods, for example, corn, peppers, green beans, soups, beets, asparagus, mushrooms, olives, spinach, chicken, liver pate, luncheon meats, ham, sausage, stuffed eggplant, lobster, tuna, other smoked and salted fish, and honey. The CDC states that honey fed to infants before 12 months of age may cause botulism due to the presence of Clostridium botulinum spores often found in honey. Therefore, don't add honey to a baby's food, water, infant formula, or apply it to a pacifier. Let's now consider Staphylococcus aureus, which is among the top 5 organisms causing foodborne illness in the United States. The CDC estimates that there are over 240,000 cases of Staph aureus each year in this country, and that 100% of the cases are caused by eating food contaminated with the toxin produced by the bacteria. About 1,000 cases will be severe enough to require hospitalization. 6 deaths are possible each year. Staphylococcus aureus is a gram-positive, spherically shaped bacteria. Staphylococcus is ubiquitous in the environment, with humans and animals as the primary reservoir for this organism. Staphylococcus can be isolated from the hair and skin of 50% of healthy individuals. When growing in foods, Staphylococcus aureus releases a heat-stable enterotoxin that tolerates high cooking temperatures, surviving even when boiled for 1 hour. In a pressure cooker, the toxin is destroyed when heated at 121 degrees centigrade or 249 degrees Fahrenheit for 30 minutes. Staphylococcus can also thrive in foods treated with high concentrations of sugar or salt, for example, hams. Staphylococcal outbreaks are often linked to foods stored in the danger zone, between 40 to 140 degrees Fahrenheit. The incubation period for staphylococcal food poisoning is between 30 minutes to 8 hours. Symptoms include nausea, vomiting, abdominal cramping, and prostration. Food sources include meats and meat products, including cured hams, poultry, egg products, salads, for example, tuna, chicken, egg, potato, cream-filled bakery products, sandwich fillings, milk, and dairy products. Let's now consider Escherichia coli 0157H7, which is among the top 5 organisms causing foodborne illness-associated hospitalizations in the United States. According to the CDC, Escherichia coli 0157H7 causes an estimated 73,000 illnesses in the United States annually. From 1982 to 2002, there were 350 outbreaks, resulting in 1,493 hospitalizations, 354 hemolytic uremic syndrome cases, and 40 deaths. Escherichia coli 0157H7 is a gram-negative organism commonly found in the intestines of cattle. The organism can contaminate meat during the slaughter process. The transmission route for 52% of cases from 1982 to 2002 was foodborne, with 21% unknown, 14% person-to-person, 9% waterborne, 3% animal contact, and 0.3% laboratory-related. 41% of the foodborne cases were associated with ground beef, and 21% from contaminated produce, including alfalfa sprouts and lettuce. Outbreak food sources have also included unpasteurized fruit juices, dry-cured salami, game meat, cheese curds, and unpasteurized milk. Illness symptoms include abdominal pain, watery to bloody diarrhea, occasional vomiting, and low-grade fever. The incubation period can range from 3 to 8 days, with a median of 3 to 4 days. The illness is often self-limited, lasting approximately 8 days. Young children are more vulnerable to developing hemolytic uremic syndrome, HUS, after E. coli 0157H7 infection. HUS can lead to acute kidney failure, end-stage renal disease, and hypertension. Campylobacter is among the top 5 organisms causing foodborne illness, hospitalization, and deaths in the United States. Campylobacter are gram-negative bacteria that cause a diarrheal illness called campylobacteriosis. Campylobacter is a common cause of bacterial diarrheal illness in the United States, affecting up to 1.5 million people annually, according to the CDC. The incubation period for campylobacteriosis is 2 to 5 days, with the illness commonly lasting 7 to 10 days, though relapses are seen in 25% of infected individuals. Symptoms of campylobacteriosis include watery to bloody diarrhea, fever, abdominal pain, nausea, headache, and muscle pain. Most people with campylobacteriosis recover completely without antibiotic treatment. When antibiotics are indicated, azithromycin and fluoroquinolones are commonly used, though Campylobacter are often resistant to fluoroquinolones. People 65 and older, pregnant women, and individuals with weakened immune systems are at risk of severe disease. Food sources for Campylobacter include raw or undercooked poultry, unpasteurized milk, untreated water, and touching animals that carry the organism. Prevention includes properly cooking and handling poultry products, pasteurizing milk, and chlorinating drinking water. Listeria monocytogenes is among the top 5 organisms causing foodborne illness deaths in the United States. Listeria monocytogenes are gram-positive bacteria that cause a disease called listeriosis. The CDC estimates that each year in the United States, 1,600 people are infected with Listeria monocytogenes, resulting in 260 deaths. Listeriosis symptoms and signs include nausea, vomiting, and diarrhea that can precede septicemia, meningitis, encephalitis, and intrauterine infections in pregnant women. Infections in pregnancy can result in 2nd and 3rd trimester spontaneous abortions or stillbirths. Treatment varies based on illness symptoms, signs, and severity. Individuals with diarrhea should receive fluid therapy to prevent dehydration. Most people recover from an intestinal illness without antibiotic treatment. Antibiotics, ampicillin alone or in combination with gentamicin, are used to treat invasive disease or individuals at risk of serious illness. Food sources of Listeria include unpasteurized milk, cheeses, for example, soft ripened varieties, ice cream, raw vegetables, fermented raw sausages, and raw and smoked fish. Listeria can grow in refrigerated temperatures down to 3 degrees centigrade or 37.4 degrees Fahrenheit. Norovirus is the leading cause of foodborne illnesses in the United States and is also a major cause of hospitalizations and deaths. The CDC estimates that norovirus causes from 19 to 21 million illnesses, resulting in 2,270,000 outpatient visits, mostly children, 465,000 emergency department visits, 109,000 hospitalizations, and 900 deaths, mostly adults 65 years old and older, annually. Norovirus, also known as Norwalk virus, causes a disease often referred to as winter vomiting disease. Norovirus is a common cause of cruise ship outbreaks. The incubation period is 12 to 48 hours after exposure. Symptoms of infection include non-bloody diarrhea, vomiting, stomach pain, headache, and occasional fever, with recovery usually seen within 1 to 3 days. Complications are uncommon, but may include dehydration, especially in the young, elderly, and those with underlying health conditions. The virus is usually spread by the fecal-oral route through contaminated food or water, person-to-person contact, and contaminated surfaces. Prevention includes hand washing, proper food and water handling, and disinfection of contaminated surfaces. Alcohol-based hand sanitizers are not effective against the norovirus, since it is a non-enveloped virus. Non-enveloped viruses are more resistant to disinfectants. There is no vaccine or specific treatment for norovirus. Supportive care includes the prevention and treatment of dehydration. Oral rehydration solutions are the preferred fluids to drink when ill, though other liquids that don't contain caffeine or alcohol are also beneficial. Another important virus associated with foodborne and person-to-person transmission is hepatitis A that infects the liver. Most people who get hepatitis A have a mild, short-term illness. Adults are more likely than children to have symptoms. Individuals with asymptomatic infection can transmit hepatitis A to other people. The incubation period for hepatitis A is between 2 to 7 weeks after exposure. Symptoms of hepatitis A include dark urine, clay-colored stools, diarrhea, fatigue, fever, joint pain, loss of appetite, nausea, vomiting, stomach pain, and jaundice, yellow skin or conjunctiva of the eyes. Most symptoms resolve within 2 months, though some individuals can feel ill for up to 6 months. Hepatitis A vaccine or immune globulin can prevent infection if given within 2 weeks of exposure. A clinician decides whether vaccine, immune globulin, or both are needed for an exposed individual. Recent hepatitis A outbreaks have occurred through foodborne and person-to-person transmission. For example, drug users, the homeless, and men who have sex with men. A variety of foods have been implicated in hepatitis A outbreaks, including pomegranate seeds imported from Turkey, 2012 to 2013. Various contaminated imported food products, 2016. And imported organic strawberries, 2022 to 2023. From late 2016 to 2022, ongoing multi-state outbreaks of hepatitis A were noted among people who used drugs and those experiencing homelessness. From 2019 to 2022, the rate of newly reported hepatitis A cases decreased 88%. Disruptions to healthcare access and health department surveillance capacity during the COVID-19 pandemic may have affected the ability to detect and report all hepatitis A cases in 2020 and 2021. In the Hepatitis A 2022 surveillance report, the CDC stated that individuals aged 30 to 39 years old had the highest rate of hepatitis A infection, and that 58% of hepatitis A cases occurred among non-Hispanic white persons. Toxoplasma gondii is a single-celled parasite that causes an illness called toxoplasmosis. A parasite is defined as an organism that lives on or inside another organism. Toxoplasma is one of the 5 leading foodborne pathogens causing hospitalizations and deaths in the United States. Toxoplasma gondii occurs worldwide and can survive for a lifetime in the bodies of humans and animals. Over 40 million people, or approximately 11% of the U.S. population, are infected with Toxoplasma gondii. These diagrams demonstrate the life cycle of Toxoplasma. When cats ingest either cis or oocysts, diagram on the left, the bradyzooites that are produced differentiate into tachyzooites and male and female gametocytes. Gametocytes then fuse to form zygotes that turn into oocysts. Those oocysts are then released into the environment via their feces. Felines or cats are the only species in which Toxoplasma parasites can sexually produce via male and female gametocytes. Excreted oocysts can infect other animals, for example rats, mice, birds, etc., when ingested. Inside these animals, the oocysts release sporozoites that go through several stages of bradyzooites and tachyzooites and eventually differentiate into cysts in brain, liver, and muscle tissues. When a human ingests oocysts from contaminated food, water, or soil, or eats inappropriately cooked meats containing cysts, the oocysts and cysts go through various intermediate stages to form cysts in the human brain, liver, and muscles, which may result in symptomatic toxoplasmosis. Most people with healthy immune systems are asymptomatic when infected. When symptomatic, individuals may experience swollen lymph nodes and muscle aches and pains. Severe toxoplasmosis may damage the brain, eyes, or other organs. Those at increased risk of severe toxoplasmosis include infants born to mothers newly infected with the parasite and immunocompromised individuals, including those with HIV/AIDS, on chemotherapy, or organ transplant recipients. Infants infected during pregnancy, called congenital toxoplasmosis, often have no symptoms at birth, but can develop symptoms months to years later, including visual and hearing loss, mental and psychomotor retardation, seizures, hematological abnormalities, hepatosplenomegaly, and death. Infectious sources for toxoplasmosis include contaminated water, contaminated food products. For example, eating contaminated undercooked meat or shellfish or unwashed contaminated fresh produce. Animal to human transmission. For example, accidentally consuming the parasite through contact with cat feces or contaminated soil or cat litter that contains Toxoplasma oocysts. Mother to child or congenital transmission. For example, a newly infected mother passing the infection to her unborn baby, and rarely through receiving an infected organ transplant or blood transfusion. Prevention measures for toxoplasmosis include taking food precautions. For example, cooking food to safe internal temperatures, 160 degrees Fahrenheit or greater, freezing meat at sub-zero temperatures for several days, rinse fruits and vegetables under running water or cook them, avoid unpasteurized goat's milk, avoid eating raw oysters, mussels, or clams, and practice good hand hygiene. People with healthy immune systems who are not pregnant often recover from toxoplasmosis without treatment. If symptomatic, a healthcare provider may recommend anti-parasitic treatments. For example, pyrimethamine, sulfadiazine, clindamycin, trimethoprim sulfamethoxazole, atovaquone, azithromycin, etc. Acute infection with Toxoplasma gondii during pregnancy and its potentially tragic outcome for the newborn continues to occur in the United States, as well as worldwide, even though it can be prevented. Transmission to the fetus occurs almost solely in women who acquire their primary infection during pregnancy. Serological screening of pregnant women is the most reliable strategy to identify at-risk pregnancies. Treatment of pregnant women and their infected infants during the first year of life significantly improves the clinical outcome for these children. In this session, we'll briefly discuss two additional foodborne parasites, Trichinella and Taenia. Trichinosis, also called trichinolosis, is an infection caused by the larvae of Trichinella, a parasitic worm or nematode. There are at least 4 subspecies of Trichinella that cause trichinosis worldwide: Trichinella spiralis, nativa, Pseudospiralis, and Nelsoni. Trichinella spiralis is by far the most common in the United States. People get infected with Trichinella after eating raw or undercooked parasite-contaminated meat from meat-eating animals such as bear, wild boar, pigs, walrus, wild cats, fox, wolf, seals, etc. Trichinosis is a rare disease in the United States, with only about 15 confirmed cases per year. Worldwide, there are about 10,000 recorded cases per year. In the past, people in the U.S. were infected by eating undercooked or raw pork containing encysted larvae. The implementation of regulations on raising commercial pigs and cooking guidelines for pork have helped lower the trichinosis risk. This diagram demonstrates the life cycle of Trichinella. Meat-eating animals eat encysted larvae in contaminated meat. The larvae exist in the small intestine and become adult worms that mate and deposit larvae in the mucosa of the gut. The larvae then enter the blood and are distributed throughout the body. The larvae then become encysted in striated muscle. When a human eats undercooked, contaminated meat, The worm goes through the same cycle as in meat-eating animals, eventually encysting in striated muscles, causing symptoms of trichinosis. Signs and symptoms of trichinosis include nausea, diarrhea or constipation, fatigue, fever, abdominal pain, headache, cough, swelling of the face and eyes, joint and muscle pain, and itchy skin. A heavy infection may also present with incoordination, heart problems, difficulty breathing, and death. People at risk of infection are those who eat raw or undercooked pork or meat from meat-eating wild game. Homemade jerky and sausage made with these meats can also be a source of trichinosis. Trichinella is not spread from person to person. Prompt treatment with antiparasitic drugs, for example mebendazole, albendazole, can help prevent the progression of trichinosis by killing adult worms in the gastrointestinal tract, and by doing so, prevents further release of larvae. Once the larvae become encysted in skeletal muscle cells, usually by 3 to 4 weeks post-infection, treatment may not eliminate the infection and associated symptoms. Prevention measures include cooking meat to safe temperatures using a food thermometer to measure the internal temperature of cooked meat. It's important not to sample meat until it's properly cooked. Additional prevention measures include good hand hygiene after handling raw meat, freezing pork that's less than 6 inches thick for 20 days at 5 degrees Fahrenheit or less to kill encysted larvae, and thoroughly cleaning meat from grinders and tools after each use. Freezing wild game meats, unlike freezing pork products, may not effectively kill all worms, since some Trichinella subspecies, Arctic species like Nativa, that infect wild game animals in places like Alaska, may be freeze resistant. Salt curing, drying, smoking, or microwaving meat alone does not consistently kill encysted larvae. Taenia is the genus term for tapeworms, also known as cestodes. Infection with tapeworms is called Taeniasis. Humans are the definitive host for 3 tapeworm species: Taenia saginata, Taenia solium, and Taenia asiatica. A definitive host is defined as an organism which supports the adult or sexually reproductive form of a parasite. Taenia saginata and Taenia solium are worldwide in distribution. Infections with Taenia saginata occur wherever contaminated raw beef is eaten, particularly in Eastern Europe, Russia, Eastern Africa, and Latin America. Taeniasis due to Taenia saginata is rare in the United States, except in places where cattle and people are concentrated and sanitation is poor, such as around feedlots where cattle can be exposed to human feces. Taenia solium infections are more prevalent in underdeveloped communities with poor sanitation and where people eat raw or undercooked pork. Higher rates of illness have been seen in people in Latin America, Eastern Europe, Sub-Saharan Africa, India, and Asia. Taenia asiatica is limited to Asia and is seen mostly in the Republic of Korea, China, Taiwan, Indonesia, and Thailand. Taeniasis due to Taenia solium is seen in the United States, typically among Latin American immigrants. Eggs or gravid proglottids are passed to the environment through the feces of infected humans or animals. Eggs can survive for days to months in the environment. Cattle with Tinea saginata and pigs with Tinea solium and Tinea asiatica become infected by ingesting vegetation contaminated with eggs or gravid proglottids. In the animal's intestine, the oncospheres hatch, invade the intestinal wall, and migrate to the striated muscles, where they develop into cysticerci. A cysticercus can survive for several years in the animal. Humans become infected by ingesting raw or undercooked infected meat. In the human intestine, the cysticercus develops over 2 months into an adult tapeworm, which can survive for years. The adult tapeworm attaches to the small intestine by their scolex or mouthpiece and reside in the small intestine. The length of adult worms is usually 5 meters or less for Tinea saginata, but can occasionally be as long as 25 meters. Tinea solium worms are usually 2 to 7 meters long. The adult worms produce proglottids, which mature, become gravid, detach from the tapeworm, and migrate to the anus or are passed in the stool, approximately 6 per day. Tinea saginata adults usually have 1,000 to 2,000 proglottids, while Tinea solium adults have an average of 1,000 proglottids. The eggs contained in the gravid proglottids are released after the proglottids are passed in feces. Tinea saginata may produce up to 100,000 and Tinea solium up to 50,000 eggs per proglottid, respectively. Most people with Taeniasis have mild or no symptoms. Taeniasis may cause mild abdominal symptoms, which are more common with Tinea saginata than Tinea solium. The most striking sign of Taeniasis is the passage of proglottids in the feces. Occasionally, Taeniasis may cause appendicitis or cholangitis as a result of proglottid migration in the gastrointestinal tract. Praziquantel is the preferred medication for treatment of Taeniasis, with albendazole as another option. Niclosamide is another alternative for children, but is not available for human use in the U.S. A major risk of Tinea solium infection is the potential development of Cysticercosis. This CDC diagram demonstrates the life cycle of Cysticercosis. Once eggs or gravid proglottids of Tinea solium are ingested by a human, they hatch in the small intestine to release a double-membraned oncosphere. The oncosphere then penetrates the intestinal mucosa and develops into cysticercoid larvae within the lymphatics of the intestinal villi. The larva then travels via the lymphatic system and blood to muscle, eye, brain, and spinal cord, where they become encysted, forming cysticerci, as diagrammed. The CAT scan on this slide shows multiple dark cysts, or cysticerci, in the brain. The location and number of these cysts in the body cause the symptoms of cysticercosis, which can occur months to years after infection, usually after the larvae die. Symptoms and signs of cysticercosis include tender lumps under the skin, altered vision, detachment of the retina, headaches, seizures, confusion, inattention to people and surroundings, loss of balance, and hydrocephalus. Treatment may include anti-parasitic drugs, for example, praziquantel, albendazole, corticosteroids to reduce swelling, for example, of the brain, surgery, or no treatment at all. Both praziquantel and albendazole should be used cautiously in patients suspected of having cysticercosis due to case reports of seizures associated with treatment. Prevention measures include cooking meat to safe temperatures using a food thermometer to measure the internal temperature of cooked meat. The USDA recommends that for whole cuts of meat, excluding poultry, cooked to at least 145 degrees Fahrenheit or 63 degrees centigrade as measured with a food thermometer placed in the thickest part of the meat. Then allow the meat to rest for 3 minutes before carving or consuming. For ground meat, excluding poultry, cooked to at least 160 degrees Fahrenheit or 71 degrees centigrade. Ground meats do not require a rest time. According to USDA, a rest time is the amount of time the product remains at the final temperature after it has been removed from a grill, oven, or other heat source. During the 3 minutes after the meat is removed from the heat source, its temperature remains constant or continues to rise, which destroys pathogens. We've covered major foodborne pathogens, including bacteria, viruses, and parasites. Let's now consider prions for a few minutes by discussing bovine spongiform encephalopathy, BSE, or mad cow disease, variant Creutzfeldt-Jakob disease, VCJD, and chronic wasting disease. Mad cow disease is also called bovine spongiform encephalopathy. It's likely caused by misfolded proteins called prions that disrupt neurons and cause degeneration of brain tissue, as demonstrated in the MRI on this slide. Human disease is called variant Creutzfeldt-Jakob disease, VCJD, and is thought to be caused by eating food like beef that contains bovine spongiform encephalopathy prions. The CDC states that strong evidence exists that consuming meat from BSE, bovine spongiform encephalopathy infected cows, causes variant Creutzfeldt-Jakob disease, VCJD, in people. Chronic wasting disease is a prion disease that affects deer, elk, moose, and similar animals in the United States, Canada, Norway, Finland, Sweden, and South Korea. This is the CDC's statement on chronic wasting disease, CWD. No CWD infections in people have ever been reported, and it's not known if people can even get infected with CWD. However, CWD is related to another prion disease in animals, BSE, that does infect people. So it is considered a theoretical risk to people. Some studies in monkeys suggest that they can get CWD by eating meat or brain tissues of infected deer or elk. These studies raise concerns CWD may also pose a risk to people. These prion diseases are incurable and invariably fatal. Initial symptoms include psychiatric problems, behavioral changes, and pain progressing to poor coordination, dementia, and involuntary movements. The length of time between exposure and symptom onset is believed to be years to decades. The average life expectancy after onset of symptoms is 13 months. These are rare diseases with an annual incidence of 1 per million. Let's now focus on marine and mushroom toxins listed under chemical food contaminants. Heavy metals, pesticides, and herbicides were covered in sessions 6 and 7 of the North Dakota Public Health Training Network Environmental Public Health Practice course. During this session, We will consider 4 marine poisonings: ciguatera, scombroid, shellfish, and pufferfish poisonings. Ciguatera fish poisoning is a foodborne illness caused by eating reef fish, for example, barracuda, grouper, moray eel, amberjack, sea bass, and sturgeon, contaminated with ciguatoxins. Ciguatoxin is made by small marine organisms that grow on and around tropical and subtropical reefs. These organisms are eaten by herbivorous fish, which in turn are eaten by larger carnivorous fish, with the ciguatoxin concentrating as it moves up the food chain. It is the most frequent seafood poisoning and occurs most commonly in Pacific Ocean, Indian Ocean, and Caribbean sea fish. Symptoms may include diarrhea, vomiting, numbness of the extremities, mouth and lips, itchiness, reversed sensitivity to hot and cold, dizziness, hallucinations, weakness, bradycardia or slow heartbeat, and low blood pressure. The onset of symptoms can range from 30 minutes to a few days, dependent on the amount of toxin consumed. Symptoms may last for weeks to years. The risk of death from poisoning is less than 1 in 1,000, according to the CDC. Preventive efforts include avoiding consumption of reef fish. Ciguatoxin has no taste or smell and is not destroyed by conventional cooking. There is no specific treatment for ciguatera fish poisoning beyond supportive care. Scombroid poisoning occurs from eating fish containing high levels of histamine due to inappropriate storage or processing. Fish commonly implicated include tuna, mackerel, mahi-mahi, escolar, sardine, anchovy, bonito, herring, bluefish, amberjack, and marlin. These fish naturally have high levels of histidine, which is converted to histamine by bacterial growth that occurs during improper storage. Contaminated fish usually look and taste normal. Subsequent cooking, smoking, or freezing does not eliminate the histamine. Scombroid poisoning occurs worldwide and is one of the most common fish poisonings. Scombroid symptoms usually develop within a few minutes to an hour after eating contaminated fish. Symptoms and signs include flushing of the face, headache, heart palpitations, itching, blurred vision, cramps, and diarrhea. Treatment with antihistamines helps relieve symptoms, yet even without treatment, individuals usually feel better within 12 to 48 hours. Prevention measures include only eating fish that have been properly refrigerated. Shellfish poisoning includes 4 syndromes that share some common features and are primarily associated with bivalve mollusks. For example, mussels, clams, oysters, scallops, cockles, abalone, whelks, moon snails, Dungeness crabs, shrimp, and lobster. As filter feeders, these shellfish may accumulate a variety of toxins produced by microscopic algae. Shellfish usually become contaminated during or after algae blooms. The 4 syndromes are amnesic, diarrheal, neurotoxic, and paralytic shellfish poisonings. Amnesic shellfish poisoning is caused by a neurotoxin called domoic acid, which can cause permanent short-term memory loss, brain damage, and in severe cases, death. Diarrheic shellfish poisoning is caused by okadaic acid that causes gastrointestinal cells to become extremely water permeable, resulting in profuse diarrhea, abdominal pain, nausea, vomiting, and dehydration. Neurotoxic shellfish poisoning is caused by brevetoxins that can produce gastrointestinal and neurologic effects. Outbreaks commonly take place following harmful algal blooms during the late summer and early fall along the coasts of Florida and Texas, which have been increasing in frequency due to the impacts of climate change. Paralytic shellfish poisoning is caused by a neurotoxin, saxitoxin, produced during algal blooms in subarctic, temperate, and tropical locations that causes tingling of the lips, mouth, and tongue, numbness of arms and legs, pins and needles sensation, weakness, loss of muscle coordination, difficulty breathing, nausea, vomiting, and headache. Symptoms of shellfish poisoning usually appear within 30 to 60 minutes of consumption, and severe cases may be fatal. Prevention measures include avoid eating potentially contaminated shellfish, particularly in areas experiencing an algal bloom, often referred to as red tide or brown tide. Pufferfish, along with porcupine fish, ocean sunfish, and triggerfish, contain tetrodotoxin, which is a potent neurotoxin that is more poisonous than cyanide. The toxin can enter the body by ingestion, injection, inhalation, or even through abraded skin. The organs, for example liver, of the pufferfish contains levels of tetrodotoxin sufficient to cause death due to respiratory paralysis. Symptoms and signs of tetrodotoxin poisoning include pins and needles sensation of the lips and tongue, salivation, sweating, headache, weakness, lethargy, incoordination, tremor, hypotension, loss of voice, difficulty swallowing, seizures, gastrointestinal symptoms, pupil dilation, and paralysis of the diaphragm, resulting in death due to respiratory failure. The flesh of many pufferfish may not be dangerously toxic. Symptoms typically develop within 30 minutes of ingestion, but may be delayed by up to 4 hours. However, if the dose is fatal, symptoms are usually present within 17 minutes of ingestion. Death generally occurs within 4 to 6 hours of a fatal dose. If the patient survives 24 hours, recovery without any after effects will usually occur over a few days. Treatment is supportive care and based on symptoms with aggressive early airway management. Prevention is to avoid eating pufferfish or other fish containing tetrodotoxin. Let's now consider mushroom toxins. Mushroom poisoning results from the ingestion of mushrooms that contain a range of toxic substances. This table lists a variety of toxins produced by mushrooms. The toxicity can include liver damage, gastrointestinal symptoms, kidney failure, central nervous system symptoms, blood dyscrasias, and cardiovascular toxicity. As listed, toxic effects can range from non-lethal to deadly. Mushroom poisoning is usually associated with the ingestion of wild, misidentified mushrooms. Prevention measures include mushroom gatherers being adequately trained to identify safe versus toxic mushrooms. Some toxins, such as amatoxins, are thermostable and therefore will not be rendered safe to eat by cooking. There are international, national, and local organizations and agencies that regulate food safety. The United Nations Food and Agriculture Organization, FAO, was founded in 1945 to raise levels of nutrition and standards of living to improve agricultural productivity and to better the conditions of rural populations. The FAO is the UN's lead agency for agriculture, forestry, fisheries, and rural development. At the U.S. national level, there are three major food regulatory programs. The Food Safety and Inspection Service, FSIS, of the U.S. Department of Agriculture, the Center for Food Safety and Applied Nutrition at the Food and Drug Administration, and the Office of Food Safety at the Centers for Disease Control and Prevention, CDC. State and local health agencies also have programs that work with national food safety agencies to implement food regulatory policies. Session 4 of the North Dakota Public Health Training Network Environmental Public Health Practice course reviews major U.S. federal government environmental regulatory agencies and laws. Key U.S. food safety regulations that have been legislated over several decades include the 1906 Food and Drugs Act, which prohibits the sale of foods considered misbranded or adulterated. The 1938 Federal Food, Drug, and Cosmetic Act that introduced several important standards for food, drugs, cosmetics, and medical devices. The Miller Pesticide Amendments in 1954 that described standards for levels of pesticides permitted in food products. The Food Additives Amendment of 1958 that defined the terms food additive and unsafe food additive. This amendment required that food manufacturers demonstrate the safety of food additives to the FDA before they could be used. The 1960 Color Additive Amendments required pre-market safety approval of colors used in food, drugs, and cosmetics. The 1968 Animal Drug Amendments provided standards to govern the safety and efficacy of drugs and feed additives administered to animals to control residues of such drugs in meats destined for human consumption. The Food Quality Protection Act of 1996 provided more effective food standards to protect children and to test products for teratogenic effects. Keeping foods safe requires training and attention to details. According to the Center for Disease Control, CDC, the cause of most foodborne illnesses can be attributed to one of the following: unsafe food source, time and temperature abuse, failing to cook food correctly, practicing poor personal hygiene, and using contaminated equipment. In summary, electronic disease reporting increased the identification of foodborne illness outbreaks in the United States. Foodborne illnesses and deaths are largely preventable. The most common foodborne contaminants are biological, chemical, and physical. Most typhoid fever cases in the United States were infected while traveling internationally. Bacteria grow most rapidly between 40 degrees Fahrenheit and 140 degrees Fahrenheit, doubling in number in as little as 20 minutes. One of the most common causes of foodborne illness is improper cooling of cooked foods. Honey fed to infants before 12 months of age may cause botulism. Norovirus is the leading cause of foodborne illnesses in the United States. Ciguatera fish poisoning is the most frequent seafood poisoning in the United States. Some wild mushroom toxins are thermostable and therefore will not be rendered safe to eat by cooking. Most foodborne illnesses are caused by unsafe food sources, time and temperature abuse, failing to cook food correctly, practicing poor personal hygiene, and using contaminated equipment.